Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, how important is drug addiction in a healthcare setting? We're going to help you understand that, help the host understand that, and then Terry Fitzpatrick is on the program as well. He's going to talk a little bit about variable electric rates, what's going on with electric bills. We'll do that and maybe a few other things after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, joining me is Dr. Jon Shapiro. He's a medical director of Physicians Health Programs, foundation of the PA Medical Society. Doctor, now look, did we color coordinate our programs? I like this. We didn't even have this conversation before the program. At any rate, look, this is a really important topic, and I've been reading over the last couple of months more stories in a variety of newspapers and magazines about drug addiction in a healthcare setting. First of all, how important a problem is this? Put it into perspective.
Well, I think we expect physicians to act professionally, and you have a right as a patient to have the best of care. The society puts a lot of energy and time, as individuals do as well, into being trained to give excellent care. Yeah. Substance abuse, like any other illness, can subtract from professionals' performance on the job. So it does represent significant risk, but also there's great opportunity to bring those physicians back to health.
How common is it?
We think that substance abuse is represented among physicians at about the same proportion that it is in the general population. Mm-hmm. Something about 10% incidence on the lifetime.
When we're talking about this, one of the elements is that I didn't hear a lot about this in the past. You know, I mean, look, I had 2 knee replacements, not to get personal about it, but, you know, I took a drug and I was happy to get off of it. I was always nervous. I mean, as a patient, I know I would get nervous that I would get addicted. Do doctors have generically, or more generally speaking, conversations with patients about that aspect of it? I mean, I don't remember my doctor, maybe he just knew I was probably not the personality. Weigh in on that a bit.
I think doctors do speak about it with their patients, but perhaps not enough. There is a lot of emphasis on the federal and state level to ensure that physicians receive adequate information about the prescription, about these important medications.
So you're pushed, I mean, I know, you know, friends of mine that I've talked to, or, you know, have kind of surgeries, they're in pain, they want something. There's a lot of pressure on physicians to relieve pain, no?
True.
I mean, think about the nature of that. Does that add to the complexity of it when somebody comes in and doctors obviously want to treat a patient, don't want a lot of pain, don't want them to be in a lot of pain?
Oh, absolutely. It's our job to alleviate pain and to keep people in health. There is a difference, there's a distinction between addiction and dependence. Any individual that takes enough narcotics will become physically dependent, and that would be defined by needing a larger dose to get the same benefit, that's a tolerance, and also withdrawal symptoms. Yeah. But that's different than addiction. Addiction goes into seeking the medication and where it kind of takes over the person's life, interfering with other aspects of their health.
That's a great point. I don't think I've ever thought of it that way. Now, what about access? It seems to me that, I mean, you hear conversations just, and these are more anecdotally, about how available these drugs are now. Is that has to play a role in it as well?
Yeah, access to medications among physicians is high, and the access may help determine what drugs tend to be abused by different specialties.
Yeah. I want to run to a break. When we come back, I want to ask you a question about signs of abuse and what is it that, you know, people do, what behavioral considerations are involved in this. We're talking with Dr. Jon Shapiro. We're getting into, I think, a very important subject that's been getting a good bit of news. We're going to help you understand a little more about that, help the host understand a little more about that. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, Dr. Jon Shapiro is here. We're talking about aspects of substance abuse, particularly when prescription drugs are given. People get candidly hooked on it. How do they get off of it? One of the questions that comes to mind is the signs of abuse. Is it something that folks can observe? Is there behavioral considerations?
Yeah, some of the things can be difficult to spot. We see sedation, the effects of medications or alcohol. Alcohol in the breath, of course, is a very basic sign. There can be signs of withdrawal with shakiness. And any change in a previous pattern of behavior may signify that there is some mental illness or specifically substance abuse.
So it doesn't have to be, just chatting and, with folks, they'll come in and talk about someone in their family or someone they know. The person's high, the eyes. But it's not just those visible signs of it, is it?
No, it could be a lot more subtle.
Yeah, a lot more subtle and therefore more difficult to diagnose.
Indeed.
Yeah. All right. We've done some programming here on a very important subject that's before the Pennsylvania legislature, medical marijuana. One state after another seems to be adopting. I've done surveys at Franklin Marshall College. The voters of the state favor it overwhelmingly, 7 in 10. Here's what but I put it this way in the polling question. Support medicinal use for marijuana, and we're supposed to call it cannabis when we refer to it in a medical way, if prescribed by a doctor. What's your sense about the medical community? And we know how it can help people, particularly with epilepsy and some. So what's your sense about this?
Well, it's a complicated issue. I speak for myself rather than for the Pennsylvania Medical Society.
Fine.
I think that marijuana is not well set up to be used medically. We do need to do more research as supported by the governor. Marijuana is usually used as a smoked form, and it's hard to believe that could be good for you. The use of marijuana is not as precise. It hasn't been as well tested, nor is it legalized by the federal government, so it is problematic.
Can you but there are ingredients in it that's separated from the one drug that causes hallucination that has been known to be helpful in treating epilepsy and some other kinds of seizures, I guess, that patients get. So are you saying that it has potential if the downsides can be removed sufficiently enough? Is that your position?
Oh, absolutely. The federal government has prohibited much research with marijuana, so there's a lot we don't know, but I suspect that there are many uses, and I certainly support further research. Specifically, weight loss, chemotherapy-associated nausea, and reduction of pain. These are three areas where marijuana has been shown to be quite helpful.
Yeah. There was some pretty... I had on this program Senator Fulmer, the prime sponsor in the Senate. Actually, there are two senators on it. One of them probably the most liberal and one maybe the most conservative. They agreed on this, and the testimony before a Senate committee was pretty riveting by patients who have benefited from it. The business of legalizing pot is another matter. I think it does require a lot more study. I try to keep my own views on these subjects. Let the guest speak. Before I let you go, I want to ask you a question about what the foundation does of which you're a medical director. Tell our viewers what it does.
Well, I thank you very much for having me on this morning. And the foundation is the charitable arm of the Pennsylvania Medical Society. The foundation has three organizations. The first one I want to discuss is the Student Scholarship and Grants. Mm-hmm. The second is called Lifeguard, and this is set up to help physicians with clinical competence. For instance, there may be people re-entering the medical field after a lapse, or older physicians that may need some assistance. And the third is the portion that I work with. That's the Physicians' Health Programs, and we are Based on physician health, we do a lot of work with physicians with substance abuse and mental health problems in general.
Well, look, thanks for coming on. This has been very enlightening. It's a subject I think we're going to be dealing with for some time. All right, coming up on the program, you check that electric bill lately? Terry Fitzpatrick is here. He's going to help us understand why it's going up and what you can do about it.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, welcome back. Well, Terry Fitzpatrick, he's one of the experts that we call in when we deal with energy subjects. He's the president and CEO of the Energy Association of Pennsylvania. Terry, as always, welcome.
Thanks, Terry.
Look, I don't know what the electric bills, I'm hearing people talk about this rising, these, double, and, trying to get a handle on what's causing this. Simply put, what's causing electric bills to go up?
Well, let me start with last winter, with what happened there. I think that's still in a lot of people's minds. Back in January, we had prolonged cold, record demand for electricity. A couple of plants went down. Some other things happened. Wholesale electricity prices went way up. Customers who were on fixed rates or who were on utilities default service didn't see that too much, although eventually they will. But customers who were on variable rate plans with competitive suppliers saw their bills double, triple, maybe even more than that in the course of 1 month. And that was a rude shock, I think, to a lot of those folks, as well as the policymakers. And I think we've been sorting that out ever since.
Yeah. Now, I know you're not, I don't want you to weigh in on whether variables are good or bad. I mean, that's, people have to make up their own minds, right. But you can certainly talk about the advantages and disadvantages. I don't know that I have a variable rate. I don't think we do. I would rather almost get locked in. I'm a little nervous. It's like variable interest rates on home mortgages. Without getting into, people can make up their own mind, but what are the advantages of, let's do that, advantages and disadvantages?
Well, the advantage of a variable rate is it's likely to be a lower rate over time, because it does not, that the supplier is not bearing the risk of price fluctuations. That risk is on the customer. I think smaller customers probably in general are going to be more wary, and should be, of variable rates, because as we found out, there was probably some complacency here all around. But as we found out last winter, electricity rates can be volatile. If the conditions are right, they can go way up. If you don't want that kind of risk, if you want more of a sure thing, and I think most small customers probably do, I think it's better to be on a price that's more stable, a fixed price, or pay attention to what's going on with those prices.
By small customers, you're talking about like households, like people in households, as opposed to like bigger businesses?
Residential and maybe small businesses, small commercial customers as well.
All right, so looking ahead, as you do, because you're the former Pennsylvania Utilities Commissioner, as you were, I'm going to put you on the spot. Why not? Sure. That's why you're here. Looking ahead, are rates going to fluctuate like this, do you think, or is there any stability that we can see, or is it just the fact of, a fact of the industry?
Well, it's a market, really, and it depends what's happening in the world around us. Right. I think it depends on what happens to the price of oil, the price of coal, and of course we have new EPA regulations are out. There's a lot of debate about how that's going to affect those prices. I think overall we're in a better position than we were 5-10 years ago because of Marcellus Shale. that has made a huge difference in our energy outlook here in Pennsylvania. So I think generally prices are certainly lower than they were 5 years ago, which is amazing. But you will still have things happen. You can't predict when they're going to be. But over time, you will have things that happen to the market where prices do go up and do spike, and that's something to keep in mind.
All right, before we run to a break, and I want to ask you about a piece of legislation and what you think about, what it does to variable rates and other aspects of energy portfolio. Let me ask you this question. Long term, then, when it comes to these rates, are there ways that folks can get information? Is this about whether the variable, does the PUC have a website? I thought I got on there some time ago and looked at that. Is there ways to find out the pros and the cons, as you just pointed out?
Yes, the PUC's Power Switch website has good information, and they've really have more emphasis since this happened on highlighting the fact that customers who have variable rates need to take a look at that to make sure that they know that they have a variable rate.
Right.
And there's also a debate going on with some PUC regulations and on legislation about what kind of regulation, what kind of disclosure should we have, and should we have caps on variable rates. That's a big issue.
Okay, we're going to take a break. When we come back, there's a piece of legislation that I want Terry Fitzpatrick to talk about that I'm asking first of all, any chance of success and what it does. We'll get into that in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Hi, welcome back. I'm chatting with Terry Fitzpatrick. We're talking about these, energy bill, the electric bills. Everybody, if you're on variable rate, you got the spike up and lots of concerns, lots of complaints to the Pennsylvania Public Utilities Commission. One of the aspects of this that's been involved in legislation by Representative Bob Gottschall deals with the variable rates and capping them. Do I got that right?
Correct.
So what's at heart of this situation? What is it that Gottschall wants to do?
Well, I think what you see here, Terry, is a debate over how much regulation versus how much competition can we have. An issue you see in a lot of aspects of our economy, and different opinions about it. Representative Gottschall believes that all the new disclosure requirements on variable rates are good, but he believes that we need to have something in addition to that you need to cap the amount by which those rates can go up each month. The suppliers and some other folks say, no, we don't like those kind of regulatory caps. It's if you fully disclose to customers what can happen with the rates, customers can make their own decisions. So it's that kind of a debate.
Now, does that have to be done in legislation? The Utilities Commission can't set those, right? Could they limit by regulation the increases in the rates on the variable plans each month?
There's some debate about that. The Commission does not believe it has the authority to do that. I think some of the consumer advocates say that the Commission does, but in any event, the Commission doesn't. It's pretty clear as a matter of policy they don't want to do that. So it's really that debate over the caps is now, and it was debated with respect to some regulations that the Commission had, which are going to go into effect. It's now a legislative issue.
On the break, we were talking about something. I'm going to switch topics on you about something that you mentioned that stunned me. You said that you think down in the Gulf Coast, down in Louisiana, where they've exported energy, they're likely now to import it, particularly natural gas from places like Pennsylvania.
Correct.
Explain that. That is really...
Yeah, well, Terry, it's all part of
historic, right?
Yes, it's all part of the energy revolution that we've had in this state. You know, we're talking about the variable rates. We're talking about a difficult situation for consumers. If you look at the really big picture of what's happened in this state, you know, in the last 5-10 years, it's actually a very good picture, because with the emergence of the Marcellus, it has really lowered our overall prices. We're still going to have spikes at times,
sure,
but overall our energy prices are a lot more reasonable than they were 5 or 10 years ago. And really nationally it's changing the outlook too, because there's so much Marcellus gas now. It's really displacing production from some places down in the Gulf Coast because it's lower cost. You have pipelines that used to transport gas from south to north. In some cases, the direction is being reversed, and it's going the other way.
There's a big debate in south central Pennsylvania about a pipeline down along the Susquehanna River. So we're going to have to go through those discussions, right?
That is a very good point, Terry, because whenever you have a new energy source like this, it only does you good as a consumer if you have the infrastructure to get it to you. Mm-hmm. But it's difficult to build that infrastructure because, you know, there's a lot of sensitivities environmentally, and people tend not to want things like that close to them. And I understand that, but we can't take full advantage of these things if you don't have the infrastructure to get it to where it needs to be used.
Mm-hmm. So eventually, do you think that given, you know, the natural, who knows what will happen with the XL pipeline? You know, the Obama administration obviously has not been willing to move forward with it. Maybe after the midterm election, we'll see. So do you think we're going to end up being a huge supplier to the world in natural gas? I mean, is that where all this is heading?
It seems to be where it's heading. We are having discussions and proposals now to build liquefied natural gas facilities that can transport it to other countries. I do think that sets off some internal debate here about whether it's better to use the gas here. Do we want to rely on international markets? You know, there's some discussion of that. But I think the market itself will tend to control that. And, you know, it looks like we will be exporting it because a lot of different parts of the world really need, you know, clean burning natural gas. There's a big demand for it.
Yeah. Before I let you go, we just have about a minute left. The EPA regulations on coal, where does it, I mean, it looks like that's a done deal now, and the states are going to have to comply, correct?
Well, there are proposed regulations out there. I think there are going to be comments on that. I think probably there's some debate, legal issues about the authority of EPA to do that under the Clean Air Act. If you recall, back maybe 4 years ago, they were trying to pass cap-and-trade legislation on carbon emissions in the U.S. Congress. That was not successful. Yeah. So they're trying to regulate it under an old statute that really was not specifically designed for it. Okay. So I think there's a lot of issues still be worked out.
All right, thanks for a great update.
Sure.
All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.